Welcome. This lecture is going to be taking you through the concepts and issues related to monitoring and evaluation of public health care programs. Primary health care as a method of health service delivery has been around for a couple of decades now, but it has regained its importance in the way health systems are designed in the face of the WHO identification and advice of member countries to adopt universal health coverage as a way of redesigning their health system. In this regard, South Africa has gone through the first stage of NHI implementation, which is underpinned by PHC re-engineering through four streams made up of a municipal ward-based PHC outreach teams, integrated school health program, contracting of non-specialist health professionals, and the adoption of district clinical specialist teams as part of strengthening the district health service. Primary healthcare service benefits covers a wide range of services that are predominantly what you would refer to as entry level into the health system, but also covers a wide variety of programs that have historically and traditionally been put into vertical programs. So it will include things such as prevention and health promotion, maternal, women and child health, HIV and TB, as well as other communicable diseases, chronic non-communicable diseases, as well as violence and injuries, which I'm sure you would be able to identify this as forming part of what is referred to as the quadruple burden of disease in South African lexicon. As a way of reflecting on where we are currently, we do know as a matter of fact that South Africa did not reach the Millennium Development Goals for mother, child and health, which the target was to be reached by 2015. But more importantly is that now South Africa cannot afford to fail to reach the Sustainable Development Goals and its targets, which need and in this regard we need to provide robust benchmarks as to be able to monitor our progress towards achieving the SDG goals. The Global Strategy for Women's, Children and Adolescents Health 2016 to 2030 provides guidance on key issues that countries should focus on. And South Africa has signed up to the global strategy and the SDGs. So it is important that we use these as frameworks within which to judge ourselves in terms of our progress towards reaching the targets and attaining the targets for sustainable development goals. Fundamental principle in issues relating to monitoring and evaluation is that you need to continuously know where you are to be able to determine where you are going and how you need to get to where you're going. So in this case, if you look at South Africa right now, or in terms of the statistics, let's look at 2016, where the institutional maternal mortality ratio was at 189 per 100,000 for 2009, and that has progressed to 135 per 100,000 in 2016, and the SDG target is 70 by 2030. And as you can imagine, we are now 10 years away from that target, and we seem to be quite far away in that regard. The neonatal mortality rate is close to the SDG target of 12 per 1,000 live births, so the country is doing well in that regard. Of note of importance is that the key neonatal mortality causes of asphyxia, prematurity, and infections, and the key under 5 mortality causes are for pneumonia, diarrhea, and malnutrition. Important in the way we understand healthcare delivery is to understand what are normally referred to as the 5 common shortcomings of healthcare delivery, or we could call them the 5 sins of healthcare delivery, and that is it's characterized by what we call inverse care, where the people with the most need get the least care, and those with the least needs get the most care, really based on your socioeconomic status. Second point is about impoverishing care, where care is not properly coordinated or monitored. It can end up in very unsustainable ways of providing care that can potentially lead to households becoming impoverished. Thirdly, it's about fragmented and fragmenting care. So this is the way in which you deliver care, where it is, we can refer to as a patient journey that is not well coordinated, and because of that, it becomes fragmented and unfortunately become quite costly as well. Unsafe care. One of the key issues that have come out of South Africa over the last couple of years was the issue around quality of healthcare, as we've been seeing reports from the Office of Health and Compliance, and also, supported by the issues around how South Africa has, been struggling with issue of medical legal litigation as a result of unsafe care. So the issue here is about making sure that people actually should be receiving care that is safe, so that they actually get access health services and come out of health services without harm being visited upon them. The fifth point is around misdirected care, where care is not well regulated. You could have misdirected care where providers are actually not providing care based on the patient's needs, but are more incentivized to do certain things that will result in them getting more money and not necessarily providing what is necessary for the patient. So that is what the issue around misdirected care is about. Now we come to issue about we come to the issues related to the introduction to monitoring and evaluation. Really, the key points to highlight here is that there's a well-known adage that says if you can't measure it, you can't manage it. So in order for you to understand the performance of a health service, you've got to be able to monitor its progress, and you must evaluate its results as key functions for you to be able to know what you're doing with relation to the improving the performance of health service. Secondly, the monitoring and evaluations shows you whether a service or a program is accomplishing its goals. It identifies weaknesses and strengths, areas of the program that need revision, and areas of the program that meet or exceed expectation. And to do this analysis of any or all of the program's domains are required. The most important thing to highlight here is that most countries actually do not know in terms of how their primary healthcare service is performing. And therefore, as a result, very little is known around the world about how the PHC is performing in most countries. What is particularly important is that there are service delivery domains that are critical to the effectiveness of a primary healthcare service model, and those are about access, comprehensiveness, continuity, coordination, people-centeredness, and quality, which can also be which needs to be looked through the lens of both a technical as well as an interpersonal one. The key issue is also about increased and improved measurement of specific primary healthcare performance with measures relevant to community, facility, district, provincial, and national processes. And these are needed to promote accountability and guide improvement. And this just underscores the point that for you to be able to know whether any system at all is doing well, is to be able to be sure that you are very accountable, and you also know exactly how to measure, so that you know whether you are achieving what you set out to achieve right from the beginning.